It is late at night. Your dog is walking across the living room, and instead of a straight line, they veer off to one side, turn, and just keep going, around and around. You call their name. They don't come straight to you. They circle towards you instead. Your stomach drops. I know exactly how frightening that moment is. You start Googling at 11 at night with your dog curled against your leg, and every single search result seems to jump straight to the worst-case scenario. You're scared, you're exhausted, and you have no idea if this is an emergency or nothing at all. But what if I told you that circling isn't one thing? It's not a diagnosis. It's a symptom, and depending on what's causing it, can mean anything from, let's watch this for a day, to get in the car right now. Today I am going to walk you through exactly how to tell the difference. What's actually happening inside your dog's body when they circle. And what you should do in the next 10 minutes if you're watching this, because it's happening right now. Hi everyone, I'm Dr. Marcus, your neighborhood veterinarian, and welcome back to the channel. If you're new here, I dedicate this entire channel to helping you become the most confident, most prepared pet parent you can possibly be. Using real veterinary knowledge, explain the way I'd explain it to a friend, not a textbook.
Ow!
Before we go any further, I want you to take a breath. You are not a bad pet parent for not knowing what this means yet. Nobody teaches you neurology before you bring a puppy home. The fact that you're watching this video right now, at whatever hour it is, trying to understand what's happening with your dog, that already tells me everything I need to know about how much you love them. So let's get into it. I'm going to give you the real science behind why dogs circle. The red flags that mean go now. The situations that are far more benign than they look. And exactly what to do while you get your dog the care they need. Grab a notebook, because some of this is genuinely going to surprise you. Let's start with what's actually happening inside your dog's head, because this is the part almost no owner has ever heard explained clearly. Deep in your dog's inner ear sits a tiny structure called the vestibular system. It's not for hearing, it's for balance. It constantly sends signals to the brainstem telling it exactly where your dog's head is in space. Up, down, tilted, spinning, still. When that system gets irritated, inflamed, or damaged, the brain starts receiving false information. It thinks the world is spinning even when it isn't. And a dog experiencing that confusion will often walk in tight circles, lean or fall to one side, or tilt their head, because their brain is trying to compensate for a signal that's simply wrong. This is not the dog being confused or silly. This is a real physical malfunction in a real physical system, the same way vertigo works in people. Here's what's truly fascinating. This single system explains the vast majority of circling cases in dogs. And understanding it is the difference between panicking and knowing exactly what to look for next. Now, here's what's truly important, and I need you to stick with me here, because this next part is the single most valuable thing in this entire video. Circling falls into two very different categories, and telling them apart matters more than any home remedy ever could. The first category is the one that needs you to act immediately. If the circling came on suddenly within minutes or hours, not gradually over days, and it's paired with any of the following. This is an emergency. A head tilt, your dog falling or rolling to one side, rapid abnormal eye movements that look like flicking side to side, vomiting, wobbliness, or a drunk-looking walk, or any sign of disorientation like bumping into furniture they normally avoid. These signs together can point to vestibular disease, an inner ear or middle ear infection that has progressed, a stroke, or in less common but serious cases, a brain lesion. I promise you, no oatmeal bath, no essential oil, and no pantry remedy treats any of these. If your dog is showing this combination of signs, the only correct next step is calling your vet or the nearest emergency animal hospital immediately, even if it's the middle of the night. This is not a wait-and-see situation, and I would never tell you otherwise. The second category is far more common than most owners realize. It's the one that usually causes the most unnecessary panic. Older dogs, especially dogs over 8 or 9, can develop something called idiopathic old dog vestibular disease. Idiopathic simply means we don't always find one clear cause. It comes on suddenly. It can genuinely look alarming, with head tilt and circling and even falling over. But the astonishing thing is that most dogs start improving within 72 hours and are back to normal within 1 to 3 weeks, often with no lasting damage at all. But and this is critical, you cannot diagnose this at home. It looks identical, in the moment, to the more dangerous causes I just described. The only way to know the difference is a veterinary exam, and sometimes advanced imaging like an MRI, if the vet suspects something beyond the inner ear. So even though this version often resolves on its own, your dog still needs to be seen and monitored by a professional, not managed at home based on a guess. There's a third, much gentler pattern worth mentioning, because I know some of you are watching this, and your dog's circling isn't dramatic at all. Some dogs circle a few times before lying down. That's an old instinctive behavior. Tracing back to wild ancestors flattening grass or checking their surroundings before settling. Anxious or stressed dogs sometimes pace in circles too, particularly before storms, fireworks, or when left alone. If your dog is circling calmly, walking normally otherwise, eating fine, and showing no head tilt, wobbliness, or disorientation, this is far more likely to be behavioral than neurological. But here's my honest rule as a vet. If you're ever unsure which category your dog falls into, treat it as the more serious one until proven otherwise. It costs you a phone call. Missing a real emergency costs you far more. Let's talk about ear infections, because they're one of the most overlooked causes of circling, and they're also one of the most treatable. A deep infection in the middle or inner ear, not just the outer ear you can see, can directly irritate that vestibular system I mentioned earlier. Dogs with chronic ear infections, allergies, or floppy ears that trap moisture are especially at risk. The warning sign here is usually a head tilt toward the affected ear, scratching at that ear, an unpleasant odor, or visible discharge, sometimes alongside the circling. The remedy here is not something in your kitchen. It's antibiotic or antifungal ear medication, prescribed after your vet actually looks inside the ear canal with an otoscope. Because using the wrong treatment on the wrong type of infection can make things significantly worse. If you catch a chronic ear infection early and treat it properly, you can often prevent it from ever progressing to the point where it affects balance at all. Now, please listen closely, because this is the most important warning in the entire video. There is no home remedy that treats the actual causes of neurological circling. Not apple cider vinegar, not coconut oil, not an ear rinse, not a supplement. Trying home treatments first, before a vet has ruled out the serious causes, is the single biggest mistake I see pet parents make with this symptom. It doesn't come from a lack of love. It comes from fear and from wanting to do something right now. But delaying a vet visit while trying to treat this yourself can allow a treatable infection to worsen, or waste precious time in a true emergency like a stroke, where minutes matter. If your dog is circling and showing any of the red flags I described earlier, please call your vet or an emergency clinic first. Everything else comes after that. So here's the golden rule, and this is what I want you to actually do step by step, starting right now if this is happening tonight. First, call. Call your regular vet if it's during business hours, or the nearest emergency animal hospital if it's after hours. Describe exactly what you're seeing when it started, whether there's a head tilt, whether they've fallen, whether they've vomited. This call alone takes about 2 minutes, and it will tell you whether you need to go in immediately or whether you can monitor overnight. And go in first thing. Second, while you're getting ready to go, make your dog's space safe. Block off stairs. Move them away from hard furniture edges or pools if you have one. Don't let them walk unsupervised near anything they could fall into. If they're wobbly, gently support them with a towel sling under the belly rather than trying to carry a larger dog. Third, do not withhold food or water unless your vet specifically tells you to, especially if there's any vomiting. Dehydration can make things worse, not better. Offer small amounts of water and let your vet guide you from there. Fourth, if you can, take a short video on your phone of the circling, the head tilt, or the eye movements before you leave for the vet. I promise you, this single piece of evidence is incredibly valuable. Because these signs can come and go, and showing your vet exactly what you saw at home helps them diagnose faster than any description in words ever could. The whole process, start to finish, from noticing the symptom to being in the car, should take you no more than 15 minutes. That's it. 15 minutes of calm, decisive action is worth more than hours of searching for a cure that doesn't exist. Watching your dog's world spin when there's nothing you can physically do to stop it is one of the most helpless feelings in pet ownership. But by staying calm, by knowing what to look for, and by choosing to get real answers instead of guessing, you are doing exactly what a devoted pet parent does. You're not panicking blindly, and you're not ignoring it either. You're responding the right way. and that makes you an excellent advocate for your dog at the moment they need one most. If this video gave you clarity today, please hit that like button. It genuinely helps more worried pet parents find accurate information instead of misinformation when they need it most. Subscribe and turn on notifications so you don't miss our weekly deep dives into real veterinary topics. And I'd love to know, has your dog ever had an episode like this? And what did you end up finding out? Tell me in the comments. I read every single one. Give your dog a gentle scratch behind the ears tonight for me. I'll see you in the next one.